So before doing this procedure, I would make sure to be in proper uniform attire, hair pulled back, name tag, scrubs, and I would also be in proper PPE according to the patient's contact precautions. I would wear a mask, but since we don't have a mask, I'll just say that I would wear a mask, and I would also be wearing a gown, that way to protect my uniform from any secretions or anything that I might get. So I'll just go ahead and knock on the patient's door. Hello, my name is Acacia. How are you?
And so then we're gonna get
Perform hand hygiene, identify the patient,
water here.
name, date of birth, hospital identification number. And I would look on both arm bracelets to see where the patient's identifying band is. Sir, could you please state your name and date of birth?
First, we're gonna check the
Alright, great. Do you have any pain today? Any allergies?
any residual.
You might know. No? Okay, great. If the patient was in pain, I would make sure to provide an analgesic at least 30 to 45 minutes before doing this procedure. I'm going to go ahead and just
30 to 15
this bedside up. Okay. And I want them at least in a semi-Fowler's position. This is to help with the secretions and flow of gravity. I'll take a cough upward as much as I can. Okay, and I'm just going to explain the procedure to the patient. So, sir, I'm going to be doing a nasopharyngeal suctioning, and this is going to help you just clear some secretions and just help you breathe a little bit better. Since my group was the clinical that went, or since my group was the lab that went to clinicals early, I'm not being taken full detail, but if this were a real situation, then I would perform a full head to toe. But I would perform my set of vitals, and I would also perform listening in. So I'm just going to go ahead and just take a listen. I would use a 10-point scale.
Pour in water. Just to help flush it and make sure we get everything out of the tube into the stomach. So we pour this in on top of the
And I would listen for any wheezes or crackles. I would also check their heart rate.
and then we just like this to go down.
I would also check their lungs posteriorly, anterior and posteriorly. Okay. So first things first that I want to do is I want to make sure that everything here is working, that everything, there's no malfunctions in the tubing. Everything works. And I have my materials here. Before placing anything on my bedside table, I'm going to make sure to disinfect it and wait a certain amount of time that I need to wait. Every 4 hours as ordered. So, I'm just going to go ahead and
I'm just going to put this up for you, and you have your full button on here if you need anything.
I had to call a nurse to get my sterile gloves, since this is a sterile procedure. So first, I'm going to go ahead and start off by putting this bed pad over his gown, so that way it can protect from any secretions or so forth. I'm going to go ahead and put this bedside roll down so there's a lot more room. I'm going to place this on the patient, so that way if he needs to spit up at all, or needs to, if he starts vomiting, then he can use that to do so. Then I'm going to also put the pulse ox, and then that way I can monitor if there's a drop in the pulse ox, and if for any reason if it went down too low, then I would make sure below 90%, then I would make sure to stop the procedure and to assess the patient. So now that I have my things here, I'm going to go ahead and start off by putting on this machine. And I want it to be at least 120 to 125, not more than 150. But again, just make sure things working. So I'm just going to place this here beside the patient. Okay. ahead and open up my materials. I want to make sure the saline hasn't been tampered with. It's not expired. Go ahead and begin by opening my. Notice I'm going to go ahead. There is a pair of sterile gloves in my catheter tray, but I'm going to go ahead and just grab it. And notice I'm still sterile. I'm just going to place that over there. I'm going to go ahead and then get my lubricant jelly, and this is for the catheter. I'm going to lubricate it about 2 to 3 inches of it, and this is just going to help ease the catheter going into the patient's nose. Okay, open it down so I take it there. And then I'm going to take my sterile solution right here. And I'm going to go ahead and pour it into my patient's container here. Okay, so let me go ahead and open it. Pour. Okay. Now that I've done that, I'm going to go ahead and then open up my sterile gloves. Once I put on my sterile gloves, I'm going to use my non-dominant hand, or I'm going to use my dominant hand to hold the catheter and place it in there, and then I'm going to use my non-dominant hand to control the wide port. So I will use my left hand, which is this hand, to hold the tubing. So I'm just going to go ahead and put on my sterile gloves. Okay, I am now sterile. I'm going to put that here. There. So now that I'm completely sterile, I'm going to go ahead and use my left hand to grab my tubing. Malfunctioning with the video. So now that I've got, go ahead and grab it. I'm going to go ahead and lubricate it 2 to 3 inches. I've measured about 16. Make sure to note that. Okay, so I'm going to go ahead and just go ahead and lubricate it 2 to 3 inches. Go ahead and suction. And I would want to do it at least 10 to 15 seconds. So I'm going to go ahead and just tell the patient, okay, I'm going to go ahead and insert it. I'm going to go ahead and go ahead and hit it once more. And I want to change each snare as I do it, so I'm going to do hit the other snare. Notice that I'm not suctioning as I put it in. I want to suction as I'm pulling out the tube. Break it once more. The other nostril. Now when we reach the pharynx, I'm going to get set up first. Okay, do that. Break it once more.
And also I'll note that I would have put
The other nostril.
the curtains already closed.
So I want to do 3 passes for each snare unless contraindicated. I would also want to at least wait 30 seconds to a minute between each pass, and not more than 10 to 15 seconds of suctioning, as it can cause the SpO2 to go down. And I would want to monitor the SpO2 as I'm doing this procedure. So now that I did the naso, I would go ahead and do the oropharyngeal, and just go ahead and tell her, okay, I'm going to go ahead and do your mouth now. So I'm just open up. And I would do 3 to 4 inches on the oro until I reach the pharynx. And I would do it as many times necessary as I needed to until he was able to get all the secretions out. So now that I've done that, I would just ask him if he's feeling all right. Maybe ask him to cough to see if he has a productive cough. Just ask him if he's in any pain, and if he's not, then I would go ahead and disconnect this. Put this back. Okay. Now we go ahead and turn this off. I'm going to remove my PPE. I would then want to wait around to assess the patient's breathing and assess how he's doing the procedure. I would want to clean up after myself, disinfect my workspace, put the patient's bedside grill up, off, put the patient back in lowest position possible, reassess their breathing, their lung sounds, reassess vitals, perform a full head to toe, and see if they were in any pain and how they feel when the procedure went. And I would ask them if they needed anything else before I left. But I would still at least stick around for at least 15 to 20 minutes so I could fully assess the patient. And then I would make my necessary documentations, and then that would be the end of my procedure.